Hello guys, hope you're all okay. You're all enjoying your life. You're also enjoying watching my videos and also enjoying practicing radiology. Today I'm gonna discuss about the differential diagnosis that is related to the musculoskeletal system. As you all know that musculoskeletal system is quite challenging, and keeping all these differentials in mind, it sometimes happens to be very difficult. Today I'm going to discuss about the lucent bone lesion, which are happens to be well defined and with a sclerotic margin in the medullary cavity, and without any expansion. They does not expand the medullary cavity. It includes geode. It includes the benign or malignant tumors that are on the healing process. So they will also appear as a lucent medullary, well defined with a sclerotic margins lesion. Fibrous dysplasia is also one of them. Beside this, there are certain benign bone lesions like simple bone cyst, enchondroma, or chondroblastoma. So these lesions appears in the medullary cavity. It does not expand the medullary cavity. Usually it contains sclerotic margin, and these are happens to be well defined. Let's look for the next slide for the complete understanding. Lucent bone lesions in the medullary cavity, well defined but having a marginal sclerosis without any expansions, indicates a slow progressing lesion. It differentially includes geode, especially subarticular cyst. Other signs may be arthritis. In healing benign or malignant bone lesion, they will appear as a lucent bone with a marginal sclerosis, especially if metastasis is going to be healed, or eosinophilic granuloma or brown tumors are in healing process. So it will appear with as a lucent bone lesion with sclerosis. Brody's abscess will appear as a lucent bone lesion with a marginal sclerosis. There are certain benign bone neoplasms as well. For example, there is a simple bone cyst. So simple bone cyst in 75% arise in the proximal humerus and femur. Enchondroma is also a bone tumor. More than 50% are seen in tubular bones of the hands, and the characteristic of enchondroma is having an internal calcifications. Chondroblastoma is an lesion which is usually seen in epiphysis, and most common site is proximal humerus. Sometimes it appears in distal femur and proximal tibia, and you can appreciate internal hazy calcification as well. Fibrous dysplasia is a condition. It's a congenital abnormalities, and it's affecting mostly bone growth and development. And so instead of maturing into the solid bone, its affected bone stay at the immature fibrous stage and appears weak and slightly delicate. So fibrous dysplasia appears on the ultrasound image as on the x-rays as a lucent bone lesion, especially in the medullary cavity. Happens to be well defined marginal sclerosis. It will having a marginal sclerosis, however it does not cause the bony expansion.